Pulmonary capillary hemangiomatosis, or PCH, is an exceptionally rare and life-threatening lung disease. Imagine a normally functioning lung, designed to efficiently transfer oxygen into the bloodstream. In PCH, this delicate system is disrupted by an abnormal proliferation of capillaries within the lung tissue. This video will explore the complexities of this condition, offering insight into its causes, effects, diagnosis, and potential treatments. The exact cause of pulmonary capillary hemangiomatosis remains largely unknown, making it challenging to pinpoint specific triggers. Research suggests a potential link to genetic predisposition, though definitive genetic markers haven't been universally identified. In some cases, PCH has been observed in association with other conditions, such as pulmonary veno-occlusive disease, raising questions about shared underlying mechanisms or risk factors. However, for many patients, the cause remains idiopathic, meaning it arises spontaneously without a clear explanation. The core problem in PCH lies in the abnormal and excessive growth of capillaries within the pulmonary microcirculation. These newly formed capillaries infiltrate the alveolar walls, the tiny air sacs where oxygen exchange occurs. This infiltration thickens the alveolar walls, making it harder for oxygen to pass into the bloodstream and carbon dioxide to be released. The increased number of capillaries can also elevate pulmonary vascular resistance, leading to pulmonary hypertension, a dangerous condition characterized by high blood pressure in the pulmonary arteries. This increased pressure puts a significant strain on the right side of the heart, potentially leading to right heart failure. Due to its rarity, precise epidemiological data on pulmonary capillary hemangiomatosis is limited. It's estimated that only a few hundred cases have been reported worldwide. PCH can affect individuals of all ages, but appears to be more commonly diagnosed in young adults, with some cases appearing in children as well. Because it is frequently misdiagnosed, the true prevalence of PCH may be higher than currently estimated. Further research is needed to understand the true scope of this condition and identify potential risk factors within specific populations. The signs and symptoms of pulmonary capillary hemangiomatosis can be subtle at first, often mimicking other more common respiratory illnesses. Patients frequently experience progressive shortness of breath, especially during exertion. Persistent coughing, sometimes producing blood, can also be a symptom. Fatigue and weakness are common, reflecting the body's struggle to get enough oxygen. As the disease progresses, symptoms of pulmonary hypertension, such as chest pain, dizziness, and swelling in the legs and ankles, may develop. The non-specific nature of these symptoms often leads to delayed diagnosis. Diagnosing pulmonary capillary hemangiomatosis is a complex process requiring a combination of clinical evaluation, imaging studies, and often lung biopsy. Initially, a chest X-ray may reveal non-specific findings, such as enlarged pulmonary arteries. A high-resolution CT scan can provide more detailed images of the lung tissue, potentially showing patchy areas of increased density or ground glass opacities. Pulmonary function tests can assess the severity of lung impairment. However, the definitive diagnosis of PCH usually requires a surgical lung biopsy, where a small sample of lung tissue is examined under a microscope. The characteristic findings include the abnormal proliferation of capillaries within the alveolar walls and surrounding structures. These capillaries will be assessed to differentiate from other lung conditions. Pulmonary capillary hemangiomatosis is not typically classified into distinct types. However, it can be associated with other conditions such as pulmonary veno-occlusive disease, POD. In some cases, PCH and PVOD can coexist, presenting a diagnostic and therapeutic challenge. The presence of both conditions can significantly impact prognosis and treatment strategies. Further research is needed to understand the relationship between these two rare lung diseases. Currently, there is no cure for pulmonary capillary hemangiomatosis. Treatment primarily focuses on managing symptoms and slowing the progression of the disease. Medications used to treat pulmonary hypertension, such as pulmonary vasodilators, may help to reduce blood pressure in the lungs and improve right heart function. Oxygen therapy is often necessary to alleviate shortness of breath and improve oxygen levels in the blood. In severe cases, a lung transplant may be considered as a last resort option. Supportive care, including pulmonary rehabilitation, can help patients improve their quality of life and manage their symptoms more effectively. Given that the cause of pulmonary capillary hemangiomatosis is largely unknown, there are currently no established preventative measures. However, avoiding known risk factors for lung disease, such as smoking and exposure to environmental toxins, may be beneficial. Early detection and prompt treatment of any respiratory symptoms are crucial. Individuals with a family history of pulmonary hypertension or other lung diseases should discuss their concerns with their healthcare provider. The prognosis for patients with pulmonary capillary hemangiomatosis is generally poor, With a median survival of a few years after diagnosis, the disease can progress rapidly, leading to severe pulmonary hypertension and right heart failure. Lung transplantation offers the potential for improved survival, but it is not an option for all patients. Recent research efforts are focused on identifying potential genetic markers and developing targeted therapies for PCH. These advances offer hope for improved diagnostic tools and more effective treatment strategies in the future. Research also continues to investigate the relationship between PCH and similar lung diseases, potentially leading to better understanding and innovative approaches to care.